as well. The webinar series this webinar is going to be recorded, so hopefully everybody is okay with that. To begin, I acknowledge and I am grateful for living on the lands of the Anishinaabe, Cree, Dakota, Dene, Métis, and Oji-Cree nations. And at CANE, we commit to righting the wrongs of colonialism by strengthening our knowledge of relationships with Indigenous peoples, where we live and work, by adopting decolonial and anti-racist practice and discourse. I also wanted to give you guys an idea of what CANE was, because we exist, we're here, and CANE essentially represents nurses dedicated to the improvement of planetary health across all domains of nursing practice, policy, research, and education. Our main focuses are advocacy and education. And in advocacy, we're dedicated to informing and advocating for planetary health balance and stability across the nation. We believe that nurses should be at the forefront of this advocacy. And to that end, we present key issues that require awareness, advocacy, and action. When it comes to education, we're dedicated to promote education of nurses and students in the context of planetary health and through the optic of intersectionality. We seek to create an awareness and provide education from a diversity of lived experiences of being in, fighting for, connecting the dots between the health of the ecosystems they are in, and what is needed for the health of both communities in these ecosystems. And it's with great pleasure that I get to present our speaker today. Dr. Roxana Chicas is an assistant professor at the Nell Hodgson's Woodruff School of Nursing at Emory University, where she researches occupational health and environmental health disparities, investigating the physiological effects of chronic heat exposures among agricultural workers. She previously completed her postdoctoral fellowship at the School of Medicine at Emory University, focusing on the impact of heat exposures and dehydration on renal physiology and pathophysiology. As a bilingual bicultural nurse scientist, she is committed to conducting research that informs policy to advance environmental justice. So welcome, Roxana, and welcome everyone. Throughout the webinar, we invite you to post your questions in the chat, and Fiona will be moderating that for us. So if you have any questions, please put them in the chat. We'll try to answer as many as we can as the webinar goes, and we'll save some time at the end to answer the bulk of them. So without further ado, Roxana, I give you the floor.
Thank you. I want to thank everyone for attending this, and also thank Jack and Fiona for inviting me to give this webinar. I'll go ahead and start sharing my screen. So I'm here to talk to you today a little bit about agricultural workers and climate change. I have nothing to disclose. I decided to get a PhD and to become a nurse because I'm an immigrant. I lived half of my life as an undocumented person in the United States. And so I was fortunate enough to be able to get a green card and go to school. And I wanted to give back to my community because I really understand a lot of the vulnerabilities that come with being a migrant and immigrant in a country. And so I'm very passionate about this topic. So as you may know, 2021 was the 6th hottest year on record. And the past decade has also been the hottest since we've started to keep track of temperatures, ambient temperature. And I think that for a long time, we have been focusing on heat exposure in agricultural workers or heat-related illness symptoms. For me, the south of the United States, a lot of research has been done like in California, in Central America and Mexico, a lot of these countries that are around the equator, looking at how heat exposure affects the health of humans. And I think that last summer we saw kind of was brought to the forefront that heat waves are starting to hit parts of this world that were not being hit before with the Northwest fires and heat waves that were happening in Oregon and Washington. And I think, there's several news clippings of heat waves that were hitting Canada. So I think it's important to that we become more informed about heat waves and how this affects vulnerable workers, particularly agricultural workers. So heat waves, as you know, is a phenomena exacerbated by climate change, and it poses an emergent global health risk for multiple reasons, right? Because, we have, mild symptoms of heat-related illness, but there's certainly some severe consequences of these heat waves, which is a heat stroke and death of very vulnerable workers. And migrant workers, I think, are particularly vulnerable because many of them are undocumented, and they perhaps don't speak the same language in the country that they're working. They're afforded very little labor protections. Certainly here in the United States, they have very few labor protections, and we don't have any federal heat protection standards at the moment. They're covered under a general duty clause, but that clause really doesn't have much bite to it to protect workers. A few states in the United States do have heat protection standards, like California. Washington, Oregon had to implement some emergency ones last summer because of the heat waves. So I think that these heat waves are something that we need to pay more attention to and be more aware of as nurses, that it does affect health. So there's a study published in 2015 that said that agricultural workers are 35 times more likely to have heat-related death, at risk for heat-related death, than any other occupation. And so when I started my doctoral study in 2016 at Emory University, my advisor at the time, and she actually continues to be my advisor, is Linda McCauley. And we had a study going on called the girasole study, or the sunflower study. And so in this study, we monitored workers for 3 days while they worked, and we took urine and blood samples before work and after work. And we gave them a core temperature pill, a sensor that they would swallow, and we would monitor their core body temperature every 30 seconds. And so what we found was that 49% of the workers exceeded 38 degrees Celsius on one of those days. And so 38 degrees Celsius, or 100.4 Fahrenheit, is what I'm sure all of you nurses know is, once you go over that, it's considered to have a fever. 10% of them went over 38.5 Celsius. And so for a long time, we knew that workers were experiencing heat-related illness, but most of the studies were all self-reported symptoms. And so this study, along with the study in California, were the first ones to kind of show, to objectively measure that workers were having heat-related illness symptoms, that their core body temperature was going above the threshold. So you can imagine that these workers are basically working, and some of them have a fever except no infection while they're working. 43% of them reported 2 or more heat-related illness symptoms like dizziness, headaches, cramps, nausea, vomiting, all of those symptoms that we experience basically when we have a fever. And so as a doctoral student, those were important results, and I wanted to do an intervention study. And so this is actually the heat hazard framework that we used in the girasole study, where we see vulnerability. We have workplace exposure, which is duration of work and work intensity, sensitivity, and adaptive capacity. So our studies in Florida are done with the Farm Workers Association of Florida, and we do not have relationships with growers. So the Farm Workers Association is a community advocacy organization. It's a grassroots organizations who advocate for workers' rights, farm workers' rights. And so they helped us recruit workers, and we saw workers at their office before they went to work. And then they were returned back to the farm workers' office at the end of the workday. And so growers are not aware that we were doing research or that their workers were participating in research, because it's been very difficult to try to build that relationship with growers in Florida. Unlike some of the, I think in California, they do have a relationship with growers, and And some of the studies done in Central America or other parts of the world do have relationships. We have not been able to establish that relationship yet. But the Farm Workers Association has been a great partner for academic research. And so kind of looking at this framework, we know we couldn't do anything as far as workplace exposure, as far as an intervention, because the relationship is not there. But we could do perhaps something with adaptive capacity. Like, what could we change? What could the workers do to try to prevent heat-related illness symptoms so that their core body temperature did not go over 38, so that they did not experience heat-related illness symptoms? So to try to maintain that physiological equilibrium. In addition to the vulnerabilities that are on that framework, again, there's also the vulnerability of lack of immigration status or living with other family members that perhaps do not have legal status. And I think in Canada, that is pretty much, you have the same issue of workers who are undocumented. And I know that you also have workers who are migrant workers who go through, through programs legally to work there. And here in the United States, we have that as well. But I think that there's lots of issues with those governmental programs that bring workers here. And sometimes those workers are, have worse working conditions than the ones that do not participate in those government programs. So in partnership with the Farm Workers Association of Florida, we wanted to do a cooling intervention. And so we came up with an intervention of using a cooling bandana and cooling vest. And first we wanted to see, like, was it even feasible to do? Could we even get, pull this off? Because again, we don't have a relationship with growers, but also would workers even want to, try any of these cooling gears, or would it be burdensome for them because of how much they move? Would it be uncomfortable to wear a cooling gear? And then we also wanted to determine the effects of these interventions on core body temperature and self-reported illness symptoms. And also look at the interrelationships of environmental temperature, personal factors, and work characteristics. And so I took the same methods that my advisor, Linda McCauley, was using for her Hirasolis study, and added these two cooling pieces. So I had four groups that were and participants were randomized either to the control group or to a group that only wore the bandana, or a group that wore only the vest. And the fourth group wore the bandana and the vest. So we had a baseline visit where we enrolled them, obtained informed consent. Everything was done in Spanish. The Farm Workers Association had community health workers who helped us do this. And of course, I speak Spanish, so I was also able to help with that. We did a survey. We took some basic, height, blood, weight, blood pressure, things like that. We gave them the core temp ingestible sensor for them to swallow the evening before they were going to go to work. And we asked them to come back in the day that they were going to work prior to starting their shifts, so that we could put on the biomonitoring equipment, which although they had the core temperature sensor inside, we still needed to put a monitor outside that would record the temperatures. And also we measured physical activity and heart rate. And so off they went to work, and everything, was worn underneath their clothes, so you couldn't see it. And at the end of the workday, they came back to the office, and we removed the biomonitoring equipment, took urine and blood, and did a post-workday survey. And so the first aim was to see, would they use the cooling gear. And so pretty much everyone used it in the bandana group. Everyone used it in the bandana group and vest group. And then 89% in the combination group used it. The two people that did not use it said that they just didn't like it. The vest was too heavy. And I think one of them also said that it wasn't really that hot to wear it. But most of them said the device did help them stay cool. Very few said it affected their productivity, which is really important, particularly for workers who are piece rate workers who are paid by the quantity that they harvest or pick. they do not want anything to affect their productivity because that could affect, how much money they're able to make for the day. Many of the workers found the bandana and the vest to be comfortable, but you can start seeing here that the vest, there's 20% of them of the vest group said that it was uncomfortable to use. So, and the vest they wore throughout the work shift. So the vest weighs about 5 pounds, and we gave them frozen inserts that they put inside the vest. We gave them 2 sets, so one for for the first half of the work shift, and then another set that they could use the second half of their work shift. And so this is one of the workers wearing the vest. The bandana was, we gave that to them, and we told them to, they would need to kind of like activate it, would be to immerse it in water and then kind of rinse, twist it to get the excess water out, and then they could put it around their neck. And they could do that as many times as they wanted to, avoiding the bandana. So the bandana was about $5, and this vest is actually about $200. So quite expensive, the vest. So here we look at heat-related illness symptoms. And so we can see here that the bandana group, the combination group had the least amount of people who reported 1 or more heat-related illness symptoms. And the control group was the one that reported the most, the higher proportion of workers who reported HRI symptoms. And as far as core body temperature, I was really kind of surprised that the bandana did much better. 38% of them went over 38 degrees. And they also spent the least amount of time over 38 degrees with a median of 23 minutes. And the combination group, the vest group had 60% of them went over 38 degrees and spent a median of 53 minutes over. So I was certainly surprised that these, the results that the bandana did so much better as far as this than the vest or the combination, because I had done a literature review looking at different interventions that had been done with outside occupational groups, and most of the interventions have been done with like construction workers. And it showed from my lit review that when workers use a combination of cooling gear and rest breaks, that seemed to be way more protective than just using one cooling gear. And so here we have, we wanted to determine the interrelationships. And here we see that the odds ratio. So the bandana, when we did the random model and unadjusted, the bandana is protective against going over 38 degrees, while the vest and the combination are not. Then we adjusted for single covariate. So we know that BMI, heat index, years worked in agricultural work, hours worked per day, and working moderate to vigorous activity throughout the day. All of those are things that can are associated with going over 38 degrees. And so even when we controlled for those factors, the bandana still remained protective, while the vest and the combination did not. Now, these are not like statistically significant results. This was a small sample of participants, but I think they're quite encouraging results that, we can improve the working conditions of these of agricultural workers and help them not suffer heat-related illness symptoms. Now, something else that we found in the Hirasolis study from my advisor, another of the big kind of findings, was that many of the workers were experiencing acute kidney injury. And there's this meta-analysis published in 2018 that said that heat strain that included, it was a meta-analysis that included a diverse population from around the world with different exposures and occupations, and found that 15% incidence of acute kidney injury or kidney disease among those who worked in high ambient temperatures for a minimum of 6 hours per day, 5 days per week, or 2 months of the year. And so, agricultural workers fit all of those criteria. They work in high ambient temperature, average time working is usually 8 hours outside, and they've been doing it for many years. And so we wanted to look at this acute kidney injury because in our study, the Girasoles study, we found that 53% of agricultural workers were dehydrated before they even started working, and 81% were dehydrated at the end of the work shift. And 33% of the participants had acute kidney injury on at least one of those 3 work days. And the odds of acute kidney injury increased by 47% for each 5 degrees Fahrenheit increase in heat index. So we see that there's some association there. And so, taking those findings plus something that you may or may not know that's going on in kind of Latin America, Central America, is that there's an epidemic called chronic kidney disease of unknown etiology happening with agricultural workers, specifically sugarcane workers, where they're having chronic kidney disease, but we don't know why, because they don't have the traditional risk factors of being overweight or having diabetes, hypertension, or being old. These are younger guys who seem to be healthy, who are having chronic kidney disease. And there's several hypotheses going on why these workers are developing CKDU, is called. Some think it's because of the heat exposure and chronic dehydration. Others think that it might be the pesticides. Others think it's leptospirosis. So lots of researchers trying to figure this out. But we knew that our workers were getting acute kidney injury in Florida. There's also some other studies published from California that found that 12% of agricultural workers had acute kidney injury, and the odds of AKI increased 34% for workers who experience heat strain. And another study that was published also from California showed that the odds of acute kidney injury increased 92% for workers who had heavy occupational workloads. So we all may know that agricultural work is pretty heavy occupational. It's physically demanding labor. And so the way that all of these studies kind of measure acute kidney injury is using the kidney disease improving global outcomes criteria. And so which says that an increase in creatinine of 0.3 indicates acute kidney injury. And so, of course, I like the biomedicine side of science, but I also like interventions. And so we thought about interventions. What can we do to protect workers from developing acute kidney injury? Now, CKDU hasn't been found here in the United States as far as like endogenously that we're seeing it being developed by workers here. We do have sometimes in the hospital someone who may be diagnosed with CKDU, but typically that's from workers who have migrated to the United States that already kind of had it, or but again, we haven't seen it here in the United States. But I think it's something that we should, looking at kidney dysfunction is something we need to be more aware of, especially us nurses who often, if you work with this population, that this is happening, perhaps assessing if they're drinking enough water and advising them on taking rest breaks so that one, to protect their kidneys, but also to protect them from heat stroke or heat-related illness symptoms. And so we looked at the literature to see, what has been done to try to protect workers from developing kidney dysfunction. And so there's 2 studies in Central America that found that sugarcane workers who self-reported drinking water with electrolytes had a lower risk of developing acute kidney injury. And there was a pilot study done in Guatemala that studied 50 sugarcane workers. And so they were given electrolyte solutions using the World Health Organization oral rehydration solutions. And workers were given 2.5 liters for a week, then 5 liters for the second week, and 10 liters for the third week. And so everyone's kidney function remained normal in all 3 groups, but which was good. And when they asked the workers, which quantity seemed best for you, they said that 5 liters was the best quantity to drink. And so thinking about these 3 studies, And also thinking about, some of the guidance that NIOSH, the National Institute of Occupational Safety and Health, gives in CDC on what their recommendations are, is that you should be drinking, if you're working outside on an 8-hour shift, you should be drinking about 5.5 to 7.5 liters per day. This is just water. They don't really mention much about electrolytes, just that, if you're out there working for a long time, then, you should have some fluids with electrolytes. But don't really tell you how much or what is a balanced electrolytes. And so kind of thinking about their guidelines as well, we decided that, we should do a hydration intervention. And so we were actually doing we had another study going on, a longitudinal study where we're following workers over the course of 2 years, and we see them in the winter, summer, to see how their renal function progresses through 2 harvest seasons, to see what kidney injury markers we see. And so in July of 21, just last year, we conducted a little pilot study, determined the feasibility of implementing hydration intervention with agricultural workers, and to see what the incidence of acute kidney injury and hydration status was. So we enrolled 30 participants that were already in our parent study, the longitudinal study. They were between 18 and 49 years of age, and all of them had been working for a minimum of 4 weeks in agriculture. And again, we did pre and post blood and urine analysis, and we randomized the participants so we had a control day, which was the day that they were participating in our parent study. So we were just basically monitoring them that day. And then on the second work day, we randomized them to either 5 liters of just plain water or 5 liters of water with electrolytes. Now, and we use the World Health Organization oral rehydration salts. And so we actually mixed them, pre-mixed it for them, and we gave them 2 of these jugs, because each jug is 2.5 liters. And we told the workers, take these jugs, try to drink as much as you can. You can drink other drinks if you'd like, but try to drink as much of this. Do not share it. Please don't, waste it or throw it out. We're okay. If you're not able to drink it all, that's fine. Just try to drink as much as you can. And so the workers went off with these jugs to drink, and then they returned back, and we got some measurements. So this is a pair match. So the water group and the electrolyte group, and the groups are pretty similar. We tend to have more women in our studies than men. I think that in Florida, men have started, well, number one, I think it's easier to recruit women in agricultural, at least for us, it is, because they're more interested in their health. And also there's been this shift of men going on to work into construction or other industries where they can make a little bit more money, and women are kind of filling this demand that there is in agriculture. So age was about 39 and 44. So electrolyte group slightly older, and actually had a little bit more years of working in agriculture, but they worked about the same amount of time, 8 to 9 hours a day. And the heat index, the max was 102, 101, kind of the same for both groups. Now, here we have, some of the biomarkers. So urine specific gravity to measure dehydration, eGFR, glomerular filtration rate, and acute kidney injury. And so what was striking here was that the electrolyte group no one sustained acute kidney injury, nor did the glomerular GFR go under 90. So this was kind of fantastic news, right? Compared to the other groups that, perhaps workers do need to be consuming electrolytes or an appropriate amount of electrolytes during the day to try to prevent them from having acute kidney injury or kidney dysfunction. And so most of the workers drank about 103 ounces, which I think it's about 3 liters. And that seemed to work. So, in the study in Guatemala, they had them drinking 5 liters and 10 liters, and they actually drank it all. And many of them reported, that they felt like their stomach was bloated and it was a little uncomfortable. So again, we really don't want to make the workers uncomfortable because their jobs are super important to them. And they're already making low wages, and their working conditions are already pretty hard. So we don't want to make it even harder. So we were very excited with this results. Again, nothing statistically significant because it's a pilot study, just 30 participants, but really much excited on really expanding this work. Here are just some of the results of serum potassium, sodium, glucose, pretty much stayed normal for all groups. And then here's just another slide of glomerular filtration rate, again, showing where the red dot is 90 and showing how no one went underneath the 90. And actually, you can see some of the workers either kept their GFR stable or went slightly up compared to the other groups who, the trend is going down. So from post-work hydration status, we did see that hydration status did improve for both the electrolyte group and the group that was drinking water. So we definitely did encourage them to drink more. In the incidence of acute kidney injury, so drinking water with electrolytes looks like it may lower the risk of developing AKI among agricultural workers. I think that the kidneys can preserve GFR in states of mild fluid loss, but which can lead to dehydration and can be replaced solely by water. But in severe fluid loss, as some of these workers have, the volume depletion can cause a decrease in GFR. And so perhaps giving isotonic solutions helps them restore their blood volume and reverse loss of GFR. So that may explain some, our favorable results in this study. And, for future studies, we're hoping to either merge both of these studies and conduct a larger study, or kind of looking right now into the literature, and also, we're talking to our Farm Workers Association of Florida to see, what we can do. But I think it's essential we study hydration intervention strategies, heat-related illness strategies to protect vulnerable outside workers from adverse health effects due to climate change. And, right now in the United States, there is I said there's no federal heat protection standards, but the Biden administration recently asked OSHA to develop some federal heat protection standards. And these studies that we've done and other groups in the United States have done are being used to kind of inform those policies. And a lot of these studies, have been nurses kind of at the forefront. I think, the studies from California, author Sally Moyes, she's a nurse. I think she's on here, which I'm pretty excited about because I like reading her work, are really informing policy. And I think that environmental health, climate change are very important for us nurses to be more aware of, to be more involved with nursing advocacy organizations, because it's we at the bedside, there's not much we can do when we have these much larger systemic issues going on. And so if we have nurses who understand these issues, specifically climate change and how that affects health, I think it's great to become advocates and advocates for our patients out in the bigger world, in the political world and policies. And so I encourage everyone to be a part of an organization of nurses who are for the environment. I see that Sarah Busick is here. She's from ANIE, the Association of American Nurses for a Healthy Environment. So I've worked with her to try to, talk to our representatives so that we can pass heat protection standards and other policies that can improve the health of our communities. And so with that, I'll go ahead and take any questions that you may have for me.
Before we take any questions, I just wanted to say thank you so much, Roxana, for starting off our webinar series in January. We really appreciate it. Fiona is going to take over with any questions. So I invite anybody who has questions to either raise your hand or put them in the chat, and Fiona will call on you to answer said questions.
Sure. And yes, just to add my thanks to this too, you had mentioned Sally Moyes, so she had put in the chat that she wanted to recognize the fantastic work and thank you for continuing to advocate for farm workers. And she's asking, actually it was a question that came to my mind as well too, whether you had investigated access to bathrooms. And that she says she believes that those who did not have regular access to bathrooms are about twice as likely to experience heat stress. And increasing hydration is important, but without a bathroom, their women will especially continue to be at continued high risk. So I don't know if you want to comment on that.
Yeah, I don't think we have looked at, I know that we've asked the question, did you have access to a bathroom today, and how many times did you go to the bathroom? But I don't think we've looked at it closely enough, which is a great thing to go and look at now. So thank you so much for that comment and suggestion. But yeah, I think that, I think the bathroom situation is really important to take into consideration, because in some of these places, there might be just one bathroom, and it might be like a porta potty, and it's not a bathroom that you want to use. And I do know that like the workers who are piece rate workers, they don't use the bathroom at the same frequency as the workers who are paid by the hour. And so, they hold it, and I've heard stories of farm workers, they're very proud that they can hold it for an entire day, that they don't have to go to the bathroom. So yeah, I think I'm going to look more closely into that. So,
I'm muted, sorry. So she said that when in the study in California, they didn't actually look at bathrooms either. So I guess that's why she wanted to also ask you about that too. Yes, so there's another question from CANE-ACIIE who says, thank you very much for your work and fantastic talk. And she was just wondering if the cooling vests come in multiple sizes, and is it possible that some were either too small or too large for some of the workers, maybe for the 20% of workers who reported the cooling vests as uncomfortable, could have been related to the size of the vests? Was that an issue?
So I didn't really go into this in the presentation, but the cooling vest we had multiple sizes, and our population is pretty overweight, and so so we did get again a variety of sizes for the workers, and we measured them to see which they would try on the vest to see which one felt more comfortable. I think that what's going on with the vests is that the workers, they wear typically two layers, like a t-shirt, and then on top they'll either wear like a button-down shirt, or sometimes they even wear a hoodie. And so they put the vest on top of their clothes. So I think that having those layers there plus extra adipose tissue there, it was harder, I guess, for the coolingness to transfer, heat to transfer outside of their body. Whereas the bandana, they wore it around their neck, and so they could, re-wet it as often as they wanted. It was lightweight, And so it's directly on their blood vessels here. So I think that probably helped, the fact that it was very lightweight, it was directly on their skin, close to their, major blood vessels here. And the vest, was, when it melted, the workers also told us this, when it started to melt, it started to weigh it down. So the weight was going down. And so that was uncomfortable for them. And what they told us was that they thought that the vest, while they liked that it was very cool, they did feel the sensation. They thought that wearing the cooling vest, if they had rest breaks, they could wear the cooling vest then and kind of get respite and cool down and then go back to work. They thought that would be a better way of using the vest instead of using it throughout the workday.
Okay, thank you for that response. So somebody else was asking whether you are aware that whether the work study has been replicated with migrant farm workers in Canada, or whether anybody might know that.
Not that I'm aware of, but hopefully this will inspire nurses in Canada to do some work with this population that I think even, now with the COVID pandemic, I've always known they're important, but it's kind of gone to mainstream now that how important farm workers are to our, to sustaining us, or giving our daily meals every day. So hopefully. So
I think you're absolutely right. And I think that certainly we, during COVID, when we were, there was a study that was just published in March last year, reminding us about the exploitation of workers and the fact that they were already short of workers in many sectors, including in agriculture. And so workers were actually working much longer hours. It was a study by Vivienne Landry from the University of Montreal and other universities here in Quebec. So the COVID pandemic actually added to that, because it added to the hours and made their conditions actually worse, as well as making them more vulnerable to COVID as well too, because of overcrowded conditions and poor housing and so forth. There's a few other questions here. One is from Jocelyn, has a small question thinking about the electrolyte drink and the promising findings. So she wonders whether the farm workers were interested or motivated to continue to drink an electrolyte drink during the workday, either homemade or bought ones.
Many of them did kind of express interest, and we're actually wondering also, this was just a one work day, right? So if we asked them, to drink it, they probably tried their best to drink the fluids. But we're also thinking, long term, would this help with kidney dysfunction and preventing AKI? And so we're thinking about, doing a study that's longitudinal, providing these electrolyte drinks. I know that many of our workers in our population prefer not to drink water that is given to them by the growers. They kind of they have mistrust in it. And they like to prepare sometimes their own waters, which have like flavors in them with some fruit. So it's a good question. Can we keep them, can we keep the encouragement, the motivation to continue drinking fluids for longer than a day?
Another question, somebody says, wondering if wearing a camelback for drinking water would help, because this person says that they wear one when biking, so can drink more and find that it really helps with hydration. So I don't know whether that's...
So we thought about doing the camelback, but we did not go with the camelback because in some of the places that these workers work, they're not allowed to take like their drinks in there or like have a camelback, for sanitation reasons. But there was a study done in El Salvador where workers were giving camelbacks. They did a water rest shade study. And so the workers were giving like a portable shade that kind of went down, they could move down the rows. And they were asked to take breaks. I think they took a break, like a 5-10 minute break every hour, and they wore camelbacks. And that study showed that it helped reduce heat-related illness symptoms. The workers felt better. This was a small study, and that their productivity, it seems as though their productivity actually increased. which is something that growers are very much interested, right, in these interventions. You know, if we're saying, you know, they have to take rest breaks every 10 minutes, every hour, what is that going to do to productivity? And I think, and the workers tell us too, and like in their exit interviews, you know, if they would give us rest breaks, then we could, you know, we could have a break and then we would start working again, more motivated and do better work.
So maybe that fits into another question that was about how the results might be translated into advocacy, actually. So for, you know, for migrant rights and health, but also in the broader conversation regarding climate change mitigation.
I'm sorry, could you repeat that?
Yes, maybe. So I guess it was this person is asking, Jocelyn is asking how you think that the results that you obtain might be translated into actual advocacy. So yeah, I guess that would be it.
So, you know, I think that agricultural workers are really at the crux of like lack of climate change policies and immigration policies, public health policies that really have not taken them into account and have been pretty much excluded. And I certainly, as a nurse and a researcher, and also being an immigrant, Hispanic, I try to do as much work as I can about bringing awareness of this issue through webinars like this, but also and speaking with, you know, members of Congress, through organizations like CANE-ACIIE, or sometimes other organizations that I can partner with to, you know, advocate for them. Right now, like I said, OSHA, the Occupational Safety and Health Administration, is asking for public comments on federal heat protection standards, and so I'm working to write a public comment, you know, using the research that we have done to kind of inform what guidelines we think that should be implemented for workers. So yeah, and I think that, you know, if workers had a pathway to have an immigration status, I think that would remove a lot of the vulnerability that they have, because these are jobs that, you know, if you're undocumented, you don't have a lot of choices as far as jobs. And when you're making very little money, and it's one of the few options that you have for working, then a lot of workers just don't speak up. And, you know, they're not allowed to unionize here in the United States. I'm not sure in Canada, it's probably the same, maybe. So, you know, a lot of their voice is taken away by these policies. So having, you know, partnering with advocacy groups, I think is great to try to, you know, try to push policy and inform it. And I think nurses are well poised to do that.
Thank you. Well, great. Thank you. And someone else says, so maybe as a follow-up to that, so you talked a little bit about, you know, extending the work and recommendations for nurses. So Sonia Jakovic says, thanks for the work and your communication about it. And she was curious about how you are extending the work and the recommendations for nurses, workers, associations, and what is next up in your line of inquiry.
Yeah, so, you know, like I said, for nurses, I think especially nurses who work in kind of this population, I think it's important to be aware of, you know, assessing occupation, and, you know, if they work in agriculture, kind of talking to workers about heat-related illness symptoms. Something else that I've found out is that, you know, we don't have emergency like CPR for heat stroke, or, you know, if a worker is experiencing a heat stroke, you know, what do you do? Do the workers know what to do? And I think that's something that I would like to also extend my work into about how, you know, what are you supposed to do? Because kind of, you know, the military has its guidelines and recommendations, and some other industries do too, but not farm workers. And I think there's also that cultural piece with farm workers, and that, I don't know if you've heard this kind of hot and cold thing that we have, that if, you know, if you're very hot and you go into something cold, that you're going to get sick. but we need to bring down core body temperature. And so we have to, teach them about that and how actually getting them, throwing a bucket of ice water on them to, if they're having heat stroke, will help save a life. Lives, I think it's very important. I'm not sure if I answered the question.
Well, I think there's quite a few. I think you did. Thank you very much. And I think Donald Cole was just providing information that temporary migrant workers are not allowed to unionize in Canada, although there have been organizing efforts in Quebec, Ontario, and British Columbia.
Yeah.
As well too, and I know that there are recommendations in the study I mentioned by Vivian Landry and co about the importance of granting permanent resident status to temporary migrant agricultural workers here, who often spend many months of the year here, up to 8 months at a time, repeatedly, but still don't often have access to healthcare and to adequate housing and so forth. So I think it's very important thing to hear about. And Shaheen says, thanks to bringing attention to an often, if not always, excluded population that are affected by multiple policy networks. Migration status as a health determinant needs more integration into the nursing point of care across sectors. We are indeed well situated to influence change. And so this person is asking, what's next for you in your research? And are you looking at any knowledge translation targeting policy?
Yeah, so yes, I agree that migration status, it should be one of the social determinants of health. And I actually teach that. I tell that to my students when I give my lecture on agricultural workers and immigrant health. So yes, I also think that another thing that we have to do for those of us who are educators, who are in nursing school, is to start weaving in climate change into the curriculum, so that we have a better, outlook of seeing, how the environment affects patients. And by the way, if you're looking to see how you can integrate climate change into your curriculum, I know that ANIE, the Association of Nurses for a Healthy Environment, have lots of resources on how to do that. But yeah, I would like to, do some kind of knowledge translation targeting policies, at some point soon in my career. But, I just got my PhD in May of 2020. So I've been trying to, kind of transition into this new role of assistant professor. And, but yeah, I'm really excited about the future and what we can do to really improve the health of this very important population.
Well, thank you. And she was certainly inspiring a lot of interest and a lot of, a lot of enthusiasm. And just to follow up with what you said about ANIE too, because here at CANE, of course, we work closely with ANIE, our colleagues in the US as well too. And Sarah, who you mentioned earlier, says to thank you very much, and saying it was so eye-opening, especially in regard to acute kidney injury and extreme heat exposure. And so she's linked in the ANIE website there as well too. And so you're right, there are plenty of resources on the ANIE website. And but we're hoping as well too, because we also need many more Canadian nurses involved as well too in these issues as well too. And the possibility that all of us can continue to collaborate together on these issues as well too.
Yes. Very important work, and lots of work out there for all of us to join in.
Exactly. And Jocelyn from Ontario says also to join the Ontario Nurses for the Environment. So there are a lot of nursing activity here, yes, on this side of the border as well too, across the country as well too. So I don't see any. I think I don't know if I've missed any. I hope I've covered all of the questions. Lots of thanks to you for the very thoughtful responses to the questions and for your presentation as well too. And
I think there was one question, was the bandana for the neck or head and neck? So the bandana, we told the workers to use it on their neck, but the bandana can be used on their forehead.
Mm-hmm. And I wondered about that as well, whether it was this bandana, it was also in a way more socially acceptable in a sense as well too, because it might be something that people would more naturally wear perhaps.
Yeah.
As opposed to a vest, whether there was
True.
an element of that.
You know, maybe. Now that you said that, I remember one of the comments of like, one of the workers said that they were asked, you know, are you wearing a bulletproof vest or something like that?
Yeah, so that's an interesting point as well too. And maybe I just would have a question, you know, about building relationships with the community organizations. You know, when the growers are not interested in partnering with researchers, how do you build relationships with community organizations to do this kind of research?
Yeah, so, you know, I think talking to them, scheduling meetings, and really like listening to the community. You know, when this research took off on heat, my advisor, Linda McCauley, she was just going to venture into doing research in Florida because most of her work had been done in the Northwest. And so she thought that she was going to go into Florida to do research on pesticides, because that's what her work had been on, pesticides. And so when she went to Florida to meet with the Farm Workers Association of Florida, and they like held meetings with farm workers, what came out was that the workers were really interested on heat and how heat was affecting their health. And so they really kind of drove the question. I think, you know, from that, we've been able to build on that relationship of listening to them. So I think that's really having a collaborative partnership where you listen to the community, I think is really important.
Okay, thank you for responding to that. And I'm conscious of the time, it's 2 o'clock. In fact, it's about 1 minute after as well too. And just some other comments saying thank you for this fantastic presentation, and that it's a very critical issue for, as June said, in BC, the interior and coastal fruit industries have many problems in taking care and also in recruiting agricultural workers, so lots of problems. And so other people saying that they're very, very thankful to you for all of that. So thank you so much, Dr. Roxana Chicas. We are very appreciative of the time that you've given to us to be able to present this webinar. And just to let everybody know that we will put the webinar recording on our CANE website, and we actually have a YouTube channel, so we'll probably put it there as well too. So for those who weren't able to attend or who wanted to re-listen, then just to let you know that they will be available as well too. So thank you very much. We appreciate it, and thank you everybody for joining us today as well too.
Thank you, everyone. Very happy to do this presentation with y'all.
Okay, bye then. Take care. Thank you.